Welcome back to my channel, Dr. Abhinav Kumar MD. We have a new background and a new patient with us who is here to share his experience, and he has flown all the way from Dubai to Patna exclusively for his hair transplantation. He belongs to the place in India called Darjeeling, which is a part of West Bengal, but he has lived in Dubai for I think 10 years. Almost 10 years. Almost 10 years. Meet Mr. Basu. First, I would like to thank him for taking so much of effort to come to Patna. So welcome, sir. Welcome back. Welcome to Patna. So have you been to part of Bihar before?
The only part I have been to Bihar is Jamshedpur. That was earlier part of Bihar. Now Jharkhand. Yes. So that was the only area that I've been before. And whenever people think about Bihar, Patna, they have second thoughts. Yeah. Right? And you have all, yeah. So I also had some second thoughts, but after interacting with you, I got some confidence. And you also told me where to stay, which areas to stay, and which are the center of the city and easily accessible from everywhere. So I think I'll just start from the beginning. How
Yes, so you got the confidence to stay.
yeah. I have been thinking about hair transplant for the past 4 years.
4 years.
Yes, and I had
When you are 44 years.
yeah, like so it matches right. So I have consulted some doctors, but you know, hair transplant, there are a lot of terminologies you might have seen nowadays, right? As confusing a lot of patients. And it was very confusing for me as well, right? So I kept on postponing. Then this year, somehow, I wanted to get it done because I'm already 44, right? So I didn't want to postpone it.
So you don't want a youthful hairline in your 60s.
Right.
You want it at least 20 years before.
Yeah. Then after that, I searched some forums, and in the forum also you will just see the common names that comes up. And one person had mentioned their name because he had done some work somewhere else, and to rectify, he remember. So yeah,
Yes, you told us.
yeah, patient. And I spoke to him, and he gave me some confidence as well. Like to rectify something else, you have to have some experience doing that. So that's how I contacted you, and the first.
So there are so many clinics. Once you contact the clinic will keep approaching you
Right.
with offers and counter offers in packages.
Right.
And terminologies.
Right. And some sale promotions are normally there, right? So with you from the initial point, I had a lot of questions, which you
And sir has just to confirm, sir has a list of 10 to 15 questions which sir asked. And these questions are very important questions. I think he was my first patient who was asked so many questions. And these questions, if patients actually ask, they will not get a bad surgery done.
right. I think by it's a habit also for me. So after that, all the questions were answered, and then I told doctor that I will decide further about it, and then I will contact him after a month. And during this whole entire month, he did not call me or message me saying that when are you going to do or that kind of sales follow up. So it made things, uh, like West, it's not solely sales focused, it gives some confidence. Yes. So then I spoke with my family members and they told me, are you confident about the doctor? And I said, yes. Then they told me, just get it done. So I messaged you. I think
So I thanks for trusting us. I am maybe new to Patna. Say we have done not many cases in Patna, but I'm old to this industry. It's almost 10 years in hair transplantation field. And I would like to focus on certain questions which sir asked. I think it is important for patient awareness.
right.
So sir asked, I think first he asked, who will you perform in which step of the procedure?
Right. The extraction.
So extraction, so we were very clear. The hairline, anesthesia, extraction, implantation. So usually as per the protocol, it is hairline designing, anesthesia and extractions are 80 to 90% performed by the doctors.
Right.
And implantation is either performed by doctor or skilled assistants. So in our case, it is as per the protocol. I am doing the extraction along with the hairline designing and along with the anesthesia, and my skilled assistants are doing the implantation. So this is the international guideline.
And then again, there are things like punch size.
So sir has very tiny question. Punch size. What is the which size your punch? Which type of punch? Do you make put singles in hairline? वो रोज में तो प्लांट नहीं हो जाएगा कॉलम्स में. So he was asking very good questions. Because I'll just put that because the today the result bad hairline is usually is very common because people don't know the art of hair transplant. So they put doubles and triples at the hairline. The angles are all wrong. The temple construction angles are wrong. The temple is not as per the facial profile. So you can put your views.
Right. And another thing is that we see a lot about things like sapphire and soy.
Choi implant, sapphire, CTS blade. So these are they will confuse you with the equipments rather than the result.
Right. So these are very confusing terms because the patient is already overwhelmed. It's a surgery that takes long, right? And it's very critical thing to implant the hair and all. And top of that, when you throw a lot of terminologies like sapphire
It's
and
like
ironing up for the patient.
like a cataract surgery. He's supposing some doctor using machine X and someone is using machine Y.
Right.
So he's saying we are using this feature which is present only in machine X.
Right.
So I think ultimately the outcome matters.
There's
It is not the only the surgery, it's the outcome which matters. So this patient should focus on, and if the doctor has good consistent result and he's himself doing the procedure along with his team is consistent
Right.
and is not trying to do too many procedures in a day.
Right, of course. Yeah, that is one point. When I initially had contacted you, I asked you about how many hair transplants you do in a month, and you told me it's maximum 4 or to the maximum 5.
Maximum 4 to 5. This month also it's like
Right.
4 to 5.
And I think you have a very good team of assistants as well. They are very confident about what they are doing.
They're more
They are not confused. When they are doing the work, I feel they were doing it with 100% confidence and not seeking your advice all the time. Although you came time and again to look at the work, how it was going on.
My assistants are more confident, but yes, you have to handhold them. Sometimes they don't become overconfident. But I am very confident of their skills and the quality of work. So it is not only a doctor, it is also the assistant and the quality of assistant which determine the outcome. Because doctor can do 40% of the work, 50% of the work, 60, but that 30 to 40% is also as important as the doctor's work.
Right.
It's the whole team work which will give the results, not only say a single person's work. So that is not a big deal. Right. So that is also an assurance from us. It's like we don't do blunders first. We do something, but it is always like the result of the surgery comes over 8 months. So you have did your best. Now the next 8 months is left up to God and his dietary habits and his lifestyle and his stress and workload. So 8 months are equally critical. But if something doesn't come, like it may happen in some cases. So we assure the patient that you don't worry and don't go to any other clinic. We can correct these small things and it is totally correctable. So that is there. And we always ask our patient to take post-op instructions seriously because it's the God who gives the hair. We just plan them. So we have to work hard, but we have to also pray to the God for 8 months that he gets the best outcome. And we wish sir a very happy Diwali.
And happy Diwali to you as well.
And we wish him the best of luck in his career. And we wish him a very happy stay in Dubai. And he should inspire more people from, you can say, from my Northeast and Darjeeling and Sikkim and North Bengal, Siliguri, to come to us. And we are confident of giving good result to his, you can say, type of face.
Right.
Yes. So people are not sure that his type of face, can we give it equally good result compared to, say, a North Indian face or a South Indian face? So his type of facial profile also, it is possible. And you will see the result over like 6 to 8 months. If sir wishes to share those photographs, we can put it on the website if sir wants. And I'm very sure that he will get a good result. And I'm very thankful, sir. So please, thanks, sir. Thanks for trusting us.
All the best to you all.